Hi, today I will be demonstrating an equine physical exam. The horse that we're going to be using is Stevie. She's a 13-year-old paint mare that is used in the animal and veterinary science teaching program. So before I actually touch Stevie, I want to observe her from a distance, see how she's acting. Is she bright, alert, and responsive? Is she appearing stressed in any manner? She seems to be kind of curious, a little bit bored, which is normal behavior for a horse that's waiting for us to do something with them. I want to make sure I have the equipment that I need. That's going to include a stethoscope. It's going to include a rectal thermometer, as well as some way to time myself. So most of the phones we use now will have a timing function on them, or you can use a plain old wristwatch. And the other nice thing about phones is they also have a light on them that you can use when you go to look into the horse's eye. So I'm going to go ahead and start my hands-on exam of her. I'm going to approach her and then I'm going to talk my way through it so you understand what I'm doing and why I do it the way I do. So when I do a physical exam on a horse, I'm going to do it the same way each time. The reason for this is if I do 100 physical exams and I do them the same way, I'm going to be more likely to pick up on something that is abnormal as opposed to if I just sort of jump around as I go. So because horses are used to us approaching them at their front end and on their left side, that's going to be where I'm going to start. So I'm going to approach Stevie. I'm going to say hello to her. She doesn't know me very well. I'm going to give her a chance to sniff me and see what I'm all about. At the same time, while I'm doing this, I'm actually checking her airflow through both of her nostrils to make sure that she's breathing evenly through them. I'm also checking her nostrils to see if she has any type of discharge. It's normal for a horse to have a little clear discharge out of either side of their nose. But if that discharge was thick, like mucus, or yellow or green, or red tinge like blood, then that would be concerning. From there, now that Stevie knows that I'm not going to hurt her in any way, I'm going to go ahead and look at her mouth a little bit. So the first thing I'm going to do is I'm going to lift up her upper lip and get a good look at those mucous membranes. They should be pale pink, and then when I take my finger and I run it across them, it should be slippery, which indicates that her hydration status is good. And then I'm going to take my thumb and I'm going to push on those mucous membranes and blanch out an area and then see how quickly does it return to that pale pink color. It should return to that pink color in less than 2 seconds. We refer to that as the CRT, or the capillary refill time. Good girl. So I slide, feels moist, I press, it fills in less than 2 seconds, so that's good. From there, if I wanted to, I could do a more involved oral exam. That would include grabbing her tongue in that interdental space, pulling it out, shining a light in her mouth to check her teeth for any sort of broken areas, damaged areas, sharp points, anything like that. But in a normal physical exam, I wouldn't necessarily do that unless there was some indication she was having trouble losing weight, dropping feet, or so forth. So after looking at Stevie's mouth, the next thing I'm going to look at are her eyes. And first I'm going to look at and make sure that she's holding them nice and open. I'm going to again look for any discharge, make sure that she doesn't have any sort of streams of mucus coming out or even just wetness. Make sure there's no green or yellow discharge, which could indicate a problem. And then, if she's willing, I'm going to shine a light into her eye and just make sure that the inside of her eye looks okay. If I wanted to do a more involved exam, I'd want to get an ophthalmoscope and really open up the pupil and do a thorough eye exam. But just on a basic physical exam, I wouldn't do that unless there was a problem indicated. So I'm going to hold on to her just because it's a bright light. I'm using my phone with the flashlight feature on it. And then I'm just going to look at her eye. Make sure that the inside looks okay. It looks clear in both that anterior and posterior chamber. She's dilating her pupil well. And look on both sides, and they look good. After looking at Stevie's eyes, I am now going to palpate her head for the different lymph nodes that we can feel. So horses have retropharyngeal lymph nodes that sit here behind their mandible, as well as submandibular lymph nodes that sit underneath the mandible, sort of in this V-shaped area. These retropharyngeal lymph nodes can get inflamed if the horse has some sort of infection going on in their head, such as strangles. That's a common one. The submandibular lymph nodes, students sometimes have a hard time finding. They feel like little chains of grapes that run on either side of the bottom part of this mandible here, going towards the horse's mouth. Hers feel good. They don't feel inflamed, large, painful, or anything like that. The other thing that I do down in this area is I'm going to palpate her pulse, and the best place to do that is the facial artery, which also runs on the inside of the mandible here. It's about the thickness of a pencil, and it does sort of move around. So my best recommendation is to take your index finger and your middle finger, come on the inside of the mandible here, right? And then you're going to try to isolate what feels like kind of a wiggly pencil in there. And then once you've isolated it, you're going to kind of stick it in between your index finger and your middle finger, apply a little bit of pressure, kind of like you would for yourself if you were feeling your pulse, and then just wait. The pulse is different than the heart rate. The pulse is going to be the blood pumping through an artery. It's really important to be able to take a pulse if you don't have a stethoscope, or if you have a horse that's in shock or having some sort of cardiovascular problem. You want to make sure that their heart rate and their pulse are consistent or are the same number. Working our way back to the horse's neck, I want to palpate it on either side and just check for any swelling or discomfort. Make sure that the horse is comfortable. And then I'm going to check the jugular vein just to make sure that it's patent or open. The jugular vein takes blood from the horse's head and brings it back towards the heart. So that means that the blood is flowing from this way down towards this way. So the best way to see if it'll fill up is to apply some pressure here at this end. I think I'm going to give her a shot. And then see if that jugular vein fills up, which it does, which means that it's open. As I work my way back on this left side, the next thing I'm going to do is I'm going to listen to Stevie's heart, which is located here kind of at the level of her elbow. And then I'm going to go from here and I'm going to listen to the different lung fields. Depending on the size of the horse, I can usually listen in about 3 or 4 different places. So I draw a line down from the withers, and then sort of a looped line back up here to the back of the ribs, and then over. So I put on my stethoscope with the earbuds facing away from me. I get out my watch or my timer, and then I listen. It's important that I give the horse a second or so because oftentimes they'll get nervous when I first put the stethoscope up and their heart rate will go up. So now Stevie's like, oh, she's not going to hurt me in any way, so her heart rate's starting to come back down. First, I'm going to listen for the overall rhythm. Lub-dub, lub-dub, lub-dub. And then I'll get out my timer, and I'm going to count the beats for about 15 seconds and then multiply by 4 to get the beats per minute. A normal heart rate in a horse is between 24 and 40 beats per minute. It'll be higher in a younger horse, higher in a horse that's painful or distressed in some manner. Hers sounds good. And then while I have my stethoscope on, I'm going to start listening to those lung sounds. So I can watch her flank to know when she's inspiring and expiring. I'm listening for sort of clear air coming in, clear air going out. I don't want to hear any pops or crackles or harsh lung sounds. Sounds good. It just sounds like she's taking a deep breath. And I want to listen for 1 or 2 breaths in each of those areas that I can. I can also get a respiratory rate at this time, or if I want, I can do that from a distance. Normal respiratory rate in a horse is between 8 and 16 breaths per minute. After I listen to both her heart and lungs, I'm going to focus in on this front leg. And what I do on this front leg, I would do on all 4 limbs as I was doing my exam. So similar to the neck, I'm going to palpate from top to bottom, feeling for any swelling or discomfort. Make sure that I don't feel any heat, especially as I get closer down to her hoof. If horses have an abscess or laminitis, you might feel some increased heat in that limb. And then I'm going to take my thumb and my forefinger and I'm going to feel for her digital pulses. I find the best place to do that is on the back of the fetlock. So if I feel here on both the medial and lateral side, if I apply a little bit of pressure, I can feel a pulse in that medial and lateral palmar digital artery. It should be really faint. Again, if a horse has some sort of inflammation or pain going on in their feet, we would expect them to have an elevated digital pulse or a bounding digital pulse, but hers feel nice today. After I felt her forelimb, now I'm going to focus in on the rest of her barrel. I'm going to check her abdomen, make sure she doesn't have any swelling there. Then I'm going to put my stethoscope back on and I'm going to listen to her gut sounds, which is the movement of ingesta through her GI tract. And I'm going to do that in 4 quadrants, 2 on this side, the upper left quadrant and the lower left quadrant, and then the same thing on the other side. And what I'm listening for is I'm just listening for movement. And that might sound like blah, 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 or it might sound like tinkle, tinkle. It's kind of like maybe what your belly would sound like if you were hungry or your belly was upset. So I'll put my stethoscope on again, and I'll tell you what I hear. This is always the funny part when I do this for students. Down here. So if you know your anatomy, you know that you're listening to the small colon and small intestine up here, the large colon down below, so they are going to sound a little bit different because the small intestine and small colon has the same diameter. The large colon has a much bigger diameter. So what I'm expecting to hear, which I do, is movement, blah, 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 with a pause, blah, 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 right? So sort of movement and then nothing and then movement. If a horse was colicking or had a blockage somewhere, you would hear decreased movement. If it was continual movement all the time, that might indicate that the horse is getting ready to have diarrhea or some other GI issue. The last hands-on thing to do with my horse is to take her temperature, and in horses we do that rectally. So I'm just going to get a digital thermometer. Some people like to put lube on it. I don't always think that you need that. So I'm going to take it, I'm going to stand really close to the horse, sort of facing backwards like this. If I stand farther away, it actually puts me at more risk of getting kicked with a lot of force behind it. So I'm going to get nice and close to her. I'm going to take my left hand and kind of move the top of her tail out of the way. I'm going to insert this into her rectum, probably about halfway up the thermometer, press the start button, and then wait. Normal temperature in a horse is anywhere between 99 and 101.5. Again, some of our younger horses can run a little hotter, so up to 102 can be normal in a foal or in a yearling. If a horse does have an elevated temperature, we consider that a fever. If it's over 101.5 or 102, it could indicate that the horse is fighting some type of infection and you need to have a vet come out and hopefully help you figure out what's going on. Once it's done, she's perfectly normal at 99.3. I remove it, turn it off, and now we're done with the hands-on portion of our exam. So the last system to sort of assess would be her skin. We sort of do that as we go along in our physical exam. We would do what I just did on the right side, sort of in a mirror, starting at the head, working back towards her right hinds. And as we're going, we're looking at the skin. Do we see any hair loss? Do we see any evidence of rain scald or anything else possibly going on with the horse? Stevie looks great. She looks nice and healthy. She's bright and alert. Her weight is good. All of her vital parameters were within normal limits. So she is good to go back outside, eat, hang out with her friends, and do what horses do. Thanks so much.